Hello, everyone. It's Dr. Lisa L. Campbell wishing you a warm welcome to part two of our week six lecture for outpatient billing and reimbursement. And as I mentioned in chapter 12, chapter 13 focuses on Blue Cross Blue Shield by itself. And soon you will know why. So let's dig in. And I don't know if you notice a trend, but each of these chapters, you get an overview of that particular type of plan, and then immediately goes into billing and primary and secondary coverage. And primary and secondary coverage is actually very important because you don't want to send the claim to the wrong payer first because that delays your overall revenue cycle process. All right. So Blue Cross Blue Shield is a household name, right? It's one of the most best known medical insurance programs in the United States. And initially, they began as two separate prepaid health plans that were selling contracts to individuals or groups for coverage of specified medical expenses as long as they got their premiums paid. Initially, the Blue Cross portion only covered hospital bills, and then the Blue Shield covered the physician component, right? And at this point, you should understand that you need physician coverage, you also need hospital coverage. So, over the years, the programs have merged together. Henceforth, we have Blue Cross Blue Shield together and have increased coverage to include almost all healthcare services. All right, so let's dig in just a tad bit. I already talked about how, initially the Blue Cross only covered hospital, the Blue Shield covered physician. Today, Blue Cross Blue Shield is a community-based, independent, and locally operated company. And so when we say locally operated company, it's all 50 states. Washington, D.C., Puerto Rico, right? So it's Blue Cross Blue Shield, Illinois, Blue Cross Blue Shield, Texas, Blue Cross Blue Shield, New Mexico. And so as you start to think about your future career and what you want to do when you grow up, just something to know. Blue Cross Blue Shield is one of the leading plans in the healthcare space, and it has history dating back to 1929 when a group of teachers in Dallas were seeking to get healthcare coverage. And so back in 1938, there was a resolution passed by the American Medical Association to help with the concept of the voluntary health insurance. Back then, the cost of the premium for Blue Cross was $6 annually. It's 2025. You can't get nothing for $6, not even eggs. So, as a result of this continued growth, the Blue Cross and Blue Shield established an association. This happened in 1977. And under the leadership of a single president, they combined and became one. And in 1986, there was further consolidation um, into a single corporation. So today, Blue Cross Blue Shield is a independent, community-based, and locally operated Cross Blue Shield company that performs basically three functions. They own and manage the Blue Cross Blue Shield trademark and names. Trademarks are very important. They grant licenses to Blue Cross Blue Shield companies to use the trademark and names. And they represent Blue Cross Blue Shield in its national forms. Additionally, you have all sorts of new programs um, and plans. So, Blue Cross Blue Shield plans that converted to a for-profit status as opposed to a non-for-profit, they have to make sure that their charitable assets are preserved. All right, so let's talk about network participation and utilization management. So, Blue Cross Blue Shield companies contract with healthcare facilities, physicians, and other healthcare professionals to form Blue Cross Blue Shield PPNs, which are preferred provider networks. This setup is designed to ensure that members receive accessible, appropriate, cost effective, and quality health care services. Now, when the patient goes out the circle, out of the network, they can expect to receive that same service, but it's going to be higher. One concept that is very common to commercial insurance plans is utilization review or utilization management. This program evaluates the accessibility, appropriateness, cost effectiveness, medical necessity, and the quality of healthcare services provided to the patients, as well as the treatment plans. In the book, they talk about this really long um, list of components. Highly recommend that you review this, and there's some terminology there that is really important to inpatient DRG from the perspective of, they talk about things like um, prospective review, concurrent review. And so I'll just briefly state this is not the DRG chapter, but I'll just briefly state that when a patient is admitted to the hospital, first of all, it has to be medically necessary, right? So the book talks about an admission review. And I always say the objective of admission is discharge because the goal is not for you to stay there forever. But then they review concurrently while the patient is in the hospital with a goal of assessing continued appropriateness of care and medical necessity, right? And to concurrently real time look at when you going home, because a hotel and a hospital are two different things. All right, on to Blue Cross Blue Shield plans. They offer different types of health insurance plans to their members, who they refer to them as enrollees or subscribers. And the types of plans that they offer are listed here for you on the slide. So, traditional fee for service, indemnity plans, managed care. When you hear the term managed care, immediately think about HMO, PPO, POS. You saw these types of plans in previous chapters. They also have the federal employee program, so those are federal government employees, and then healthcare anywhere. One benefit of participating in Blue Cross Blue Shield plans is the Blue 65, and this service provides members with discounts on health and wellness products. And I can tell you, as a person who has Blue Cross Blue Shield, whoo, they call you up, want to tell you about these programs. In fact, it's February 23rd. I think they've been calling me for about 3 months. I said, okay, I'm gonna put on my list to call them back because they want to tell me about the services that they have. The really the goal is to try to keep you healthier, right? So that you know what resources are available, how to get them at a cheaper price point, just a whole host of things. All right, so traditional fee for service. I talked about fee for service in the last chapter, right? That is, I like to call it an old school term that basically means the organization is reimbursed according to a fee schedule after the work has been done. So it's not a um, reimbursement before, it's after the work has been done. And the traditional fee for service plans include what's known as basic coverage. So that's like physician office visits, having a baby. And then major is like when you get admitted to the hospital, extended length of stay, and all of that. So we've talked about indemnity before. So I'll just briefly state that they are similar to the traditional fee for services, but they provide members with the option to receive care from any provider. Now, when you are opting to receive care for any provider, you pay the cost to be the boss. Indemnity plans may cost more than other health plans, including fee for service, and then the managed care plans. Speaking of managed care plans, you should know by now managed care is a health care delivery system that has a goal of controlling costs. They do this by requiring patients to receive services from a network of physicians, hospitals, and other healthcare providers. Quite frequently, with managed care, providers are compensated based on what is known as a capitation process. This is where they receive a per member per month fee, or they receive money on a yearly basis. And if I could summarize this for you in terms of what it looks like, it's basically they have these patients on their list and they get paid this payment to care for the patients for that year. And it literally works um in their favor if the patients don't receive care. But the more care, the more the patient needs, it eats away at that capitation payment. All right, then we have the coordinated home healthcare program. And this is where there is a coordination between an inpatient facility and a home health agency to facilitate care of the patient at home. There is this huge belief that you heal better and faster at home. And as a person who had outpatient surgery last year for an ankle fracture, I do feel like at home I was more comfortable because it was in my bed. I'm not competing with other patients. So I personally believe in home health care as long as the home is safe to provide those services. So moving on to more managed care programs, EPO, exclusive provider option. This is where the patient receives healthcare services through a network of physicians, hospitals, and other healthcare providers. There is a disclaimer. Patients must obtain services from the EPO providers, or the patient is responsible for the charges. So, do you see like the trend? You pay the cost to be the boss. Like that's the thing, right? All right. Then we have health maintenance organizations, also known as HMO, and with an HMO, the plans share the financial and healthcare delivery risks with other providers to offer this really comprehensive services to the patient. The book gives some examples of like Empire, Blue Cross Blue Shield as an option. So make sure that you review that. All right, then we have the OPAP plan. And the OPAP plan, outpatient pre-treatment authorization plan, requires pre-authorization of outpatient physical, um, speech therapy services, acupuncture, all of that. You can't go unless you get that service pre-authorized, right? So it is issued. The authorization is issued pre-service before the service is rendered. All right, next up, we have the managed care point of service plan, also known as POS. And POS allows the members to choose at the time services are needed, whether they're going to be in network or out of network. With a point of service plan, the patient chooses a primary care physician. The primary care physician is responsible for coordinating the show. I like to say the primary care physician is like the captain of the ship. Then you have PPO, which is a preferred provider organization. And this is, I like to call this the step up from the HMO. It costs more to have the PPO, but as a patient, you have greater flexibility. And, this concept is the same. You pay the cost to be the boss, right? With some PPOs, especially with Blue Cross Blue Shield, they do require a secondary opinion, a second opinion when a patient is considering surgery, because they basically want to make sure that, yeah, you need this surgery, but we want to just check. All right. Federal employee program. And I was kind of gasping as I was thinking about this because there's a lot of federal employees who are have lost their jobs, are losing their jobs, and they are covered under this program. So it was implemented in 1960, and today it provides coverage to millions of federal members, dependents, retirees. My father worked for the post office, so that's a federal government job. And the FEP plan is underwritten and administered by Blue Cross Blue Shield companies, and the claims are submitted to the local Blue Cross Blue Shield option, regardless of the FEP's plan affiliation. Under the Blue Cross Blue Shield trademark, the letter R in front of the number, um, the patient have the option of or access to the government-wide service benefit plan. And basically, that lets us know that they are a part of that plan. So here is the example of the card that is also in the book. All right, Medicare supplement programs. Now, remember, I told you for chapter 12, Medicare is always the payer of last resort. Blue Cross Blue Shield corporations offer several federally designated and regulated Medicare supplemental programs. We talked about that we will talk about that in chapter 14. So that's going to be next week. And these plans augment the Medicare program by paying what Medicare doesn't pay. So, I want to be clear in that whole primary, secondary concept, right? So, let's just table that for now, because I don't want you to get confused. Because right now we're talking about Blue Cross Blue Shield. All right. As it relates to, we always talk about billing notes. And so claims go to the local office for processing, not to the patient's home Blue Cross plan. These plans do have what is known as a timely filing deadline. Generally, the claim has to be submitted 1 year from the date of service. You will see when we get to Medicare, that is a little different. Some payers are 90 days. You got to get the claim in for 90 days. And if you think about it, who wants to wait a year to get paid for services? Especially we need that money to meet our payroll, right? Um, Blue Cross Blue Shields accept the 1500 claim form for professional services, the UBO4 for hospital services. And some plans do require that second opinion if you are having what's known as an elective surgery. Now, something that you should get familiar with all of these plans is that you have to have the premium to get the plan started, right? And then on an annual basis, the patient has to meet what is known as a deductible. And the deductible is the dollar amount that you have to pay before the insurance company will pay. And other things you should know are about co-payments. So co-payment is basically a percentage of what the patient will pay. So like the insurance company may pay 80, the patient pays 20 after the deductible is met. Now, I just gave you a number of 80/20. It could literally be 60/40, meaning the insurance company pays 60 and the patient pays 40. When we submit our claims to Blue Cross Blue Shield, just remember, if we are participating in the Blue Cross Blue Shield program, we agree to accept what they pay us as payment in full. And when our patients visit us, they sign a form that says they agree that the payment goes to us. That is called assignment of benefits. All right. And lastly, here in the textbook, they talk about primary versus secondary. And so Blue Cross Blue Shield has primary claim status when the patient is either only covered by one plan. They have an employer plan or a government plan. They have an EGHP and an individual commercial plan, or EGHP and is also listed as a dependent on another EGHP plan. All right. And then, of course, you know about the secondary situation. Some patients have more than one insurance. It's always a good idea to ask the patient if they have a secondary insurance. And in those cases, what happens is that impacts our claims process as you see listed here. All right. This was chapter 13. Next week, we are going into Medicare and Medicaid. See you next week.